The following program contains discussions of health conditions that may be distressing to some listeners. Views expressed are those of the featured individuals and do not represent of the host. This program is not intended to defame or disparage any individual, entity, caste, community, race, religion, institution, or person. Listener discretion is advised. Please note that this program does not provide professional medical advice. Consult a healthcare professional for personalized guidance. I want to know, why are people so afraid of consuming egg?
Because the powers that be, and I'm not naming them, they have controlled this. They don't want you to take it, so that
Give me these prerequisites that everybody should keep in mind. If someone is having a heart attack at home,
first of all, you have to understand the symptoms.
I heard one of your videos where you said cholesterol has become a swear word almost, and it is not that.
85% of the cholesterol that you measure in your blood is made in your body.
What sort of a role does alcohol play in raising your cholesterol levels and then subsequently leading to heart
You
disease?
see, it's not the alcohol, it's the sweetness of the alcohol.
Why are so many younger people these days getting blockages in their heart and getting heart attacks?
So nutrition is left back. Everybody wants to make a quick buck.
To a healthy person, is there a way to tell if your heart is weak or strong?
First do a CT angio, it tells you there's a block. If there's no block, the matter. The majority of the heart disease, majority of autoimmune illnesses are all caused by vaccines, not the COVID.
Hi, I'm Neha and this is the Lifesavers Show. Today, I am having the most wonderful chat with Dr. Alok Chopra, who is a senior cardiologist in Delhi. He's telling me all that you need to know about cholesterol, insulin spikes, how to treat a heart attack at home, and how to get regular tests done to basically stay off the doctor's table. Let's listen in. Hello, Dr. Chopra. Welcome to the Lifesavers Show. Thank you so much for joining me.
How many lives
And-
have you saved so far?
I am waiting for you to do that because you're the expert in the field.
Okay.
Yes. So as a renowned cardiologist, firstly, I want to know, what does your diet consist of? What exactly does a cardiologist eat? How does the cardiologist start his day?
Okay, I need to tell you also something that I was brought up as an invasive cardiologist, but since I went into functional medicine, so now I am become everything, which means,
Okay.
of course, I do cardiology, but I do reversals of chronic illnesses. So that
Okay.
is my main theme at the moment: reversing heart disease, reversing autoimmune disease, reversing thyroid disease, neurodegenerative disease, longevity. All that is covered in this functional medicine. Yeah, but
Okay.
so what was your question?
My question was, as a person who does so many things, how do you start your day? What are the foods you consume? How do you start your day with movement? Do you start your day with mobility?
I'll tell you
I
that.
want-
This is a very important question. I'll first address that. You see, there is a thing called our ancestral past, which you have to honor. Why do we have to honor it? Because our DNA, which is 20,000 years old, is still within us. The same DNA, yours, mine, and 20,000 years old is the same one. I have living my life in sync with my body clock. And I'll tell you what it is. So you have to wake up around 5:15. Okay.
Mhm.
Now, you don't wake up at that time, you miss the first class. The body
Okay.
clock wants you to immediately expose yourself to the blue light of the sun immediately. But interestingly, the blue light is invisible, but you can see the blue haze. So in any case, you face the place where the sun is going to come. Allow the blue light to come in, because it's a very important part. Because the blue light converts your night chemicals, your night hormones, your night mechanisms into the morning ones.
Okay.
You miss that part also. Then the Mr. Yellow Sun comes. So when the
Okay.
yellow sun comes, you open up your chest. I don't mean open up your shirt, but allow the sun to imbibe it. This part of the sun is very different from the 12 o'clock sun. It has a very
Okay.
powerful intervention to rejuvenate your body. After that is done, I thought I added my 2 penny bits into the body clock by saying that now that you're facing the sun for a while, why don't you use this time, about 45 minutes, for pranayam and prayer? And I do that every time. And I want people to do at least 3 pranayam, which is Kapalbhati, Anulom Vilom and Brahmari. इतना तो जरूर करो और अगर नहीं आता करना तो वो भी सिखा दूंगा.
Okay.
Then immediately after that, you want to do a aerobic activity.
Okay.
So in sequence, wake up, blue light, yellow light, prayer, pranayam, aerobic activity. So aerobic activity could be anything. It could be high intensity interval training. It could be running. It could be swimming or treadmilling. Woke up. Then the body clock wants you to eat your first meal around 5-ish hours of waking. See, now we also know that our body clock also wants to eat not more than twice. Okay? And once in a week, it's once a day. So 10 o'clock, 10:30, I have my first big meal because our ancestors used to do so much work, running around, manual work. They really worked up a great appetite. That's why our first meal becomes the biggest meal and we do the ulta.
Okay.
So the first meal is 60-70% of my total intake is in the first meal. And at 10:30 is an odd time. It's a very busy time in the hospital. So what I've done is that at 10:30, there is one Mr. S.K. Khanna who comes every day at 10:30. There's no S.K. Khanna. This is a box. And it's written in my appointment book. So I use that time for eating. And so immediately after that, I'm boom into my work.
Okay.
Then around 2:30, the body clock wants you to take a nap. 5 minutes to sleep, 5 minutes to wake up. So is it 40 minutes? So that nap is a theta rhythm sleep. Fantastic. Theta rhythm is a very powerful sleep. It wakes you up with great energy. It makes you find new problems to be solved, things like that. Use that time from 3 o'clock. When you finish this, into the rest of your work with full zest and energy. And around 6:37 is the best time for your strength training. So the body clock wants the aerobic activity in the morning, strength training in the evening. I can help them. That's the body clock. Then soon after that, 7:30 is your meal time, and 10:30 is your sleep time. If you call me for dinner tonight and I say, "जी मैं तो खा के आऊँगा," you will say, "बाहर में जाओ खा के आओगे यार. You have to come and eat with us." So I'll come and eat with you, and I will. What time will you serve food? 11 o'clock. Okay. So I'll have the food at 11, but I won't eat what I'm not supposed to eat. And next day I will do a 1-day fast.
A 1-day fast.
So that is the body clock. So if you can fit your life to it, you'll see the difference.
Okay. So that's also called a circadian rhythm. Like this what you're trying to explain is basically the circadian rhythm that goes back.
So this is controlled by the circadian rhythm. So what I've told you is what the circadian rhythm does to you, what I've talked about.
Okay. How do you start your day, Dr. Chopra? What is your first meal of the day? What does it consist of?
I start my meal with bullet coffee. But before my meal, I will drink some tea, anything which is not metabolically active. Because if I eat something which is metabolically active, so I have green tea, black tea, green coffee, black coffee, nimbu pani, dhania pani, methi pani, whatever. And when the time comes to eat, I start my meal with a bullet coffee, which I think you know. Bullet coffee is, I put in a generous helping of MCT oil, a little teaspoon of butter, some cinnamon, and a little blob of makhan. And with it is my soup. So my soup and tea comes together. The soup, say tomato soup or almond soup with broccoli and things like that. And so wo bada zaruri hai. Then the first thing I have is a fiber. Now, most people do not eat fiber in the beginning. And I worked out that starting your meal with the green fiber, green patta, will line your intestine and not let other ingredients which are not right to be absorbed. So if you start your meal with the fiber, followed by palak, saag, kundru, sara kuch karke, then comes your protein, then comes your fat, and then comes your carb, if at all. So if you do this in sequence, your body will be much happier and it will reduce the glucose spike by about at least 20%.
Okay. So do you have eggs? Are eggs included in your diet?
First, put a hand on your heart. Because when I tell you how much eggs I have, you might have a heart attack. I eat 6 to 8 eggs every day. Needless to say, with the yellow. Do not eat. Can
I just intervene once? And I want to say that I have debunked this myth that yellows are bad, eggs are bad. Because for so long I have been hearing this, अंडों से गर्मी चढ़ती है, गर्मियों में अंडे नहीं खाते हैं. Eggs are only for the winters. You do not have full eggs, you have only egg whites. So I have a
This is bull
cardiologist
crap.
who
Bull crap.
into functional medicine, and he's debunked that myth completely, trashed it in the bin, and he has 6 to 8 eggs.
But I'll give you the science bit. With 6 to 8 eggs is that, and then
Okay.
sometimes it's more, and also I make my own routines, and
Okay.
I need a Nobel Prize for this, I have invented a roti with 0 carbs,
Okay.
and I've been eating that for the last 6-7 years, and I'm giving it to my diabetic patients. So in that roti also there are 2-3 more eggs. So matlab 11-12 ande ho gaye.
Okay, so I want to know, why are people so afraid of consuming eggs? Now that you've come out with saying that,
Because the powers that be, and I'm not naming them, they have
yeah.
controlled this. They don't want you to eat egg, so that if you don't eat the egg, you get sick. You see, have you ever wondered that despite the miracles of medicines, the chronic illnesses are on the rise, and that
Mhm.
the reasons is no cholesterol in your body and
Yeah.
no insulin. Now,
Okay.
every idiot doctor tells their patients that you must have some this Pantocid because it will prevent your acidity. Now, you give
Yeah.
it to a guy who has acidity, not the guy who doesn't have it. And if you do
Mhm.
have acidity, give him that Pantocid for 1 week, 2-3 weeks. Stop it, for God's sake. Now, what
Mhm.
happens is, what is Pantocid doing? Everybody thinks Pantocid is an antacid. It's not an
Mhm.
antacid. It is an acid blocker. That means for good, your body is not making acid. Now,
Okay.
God made 2 things in our body to run our metabolism. One is cholesterol and one is acid.
So to an extent, it is right. There are a lot of doctors who overprescribe medications, and they seem to continue for months on end without, telling them that they should stop. Well, I believe that any drug that is prescribed, any pharma drug that is prescribed, there are side effects to each particular drug. Am I right?
You're absolutely right. The question is that we can solve 90% of our diseases, chronic diseases I'm talking. I'm not talking about
Yes.
emergency medicine.
Yeah.
That's the only time when modern medicine is good. I'm not a traitor in the rank of modern medicine. I run a ICU, which is, using all that stuff.
Yeah.
But 90% of the things, taking another maybe month or 2 later, we can work it out.
Excellent. So you do believe that, especially senior citizens watching this podcast, that they should include eggs in their diet every single day?
Please do.
Yes? Okay. Okay. Now, another thing, Dr. Chopra, I want to ask you.
Can I tell you what cholesterol, what's the job of cholesterol?
Please tell me.
No.
Because this has become, actually, I heard one of your videos where you said cholesterol has become a swear word almost. And it is not that. So every time, even when I speak to my parents' friends, and they seem to use this cholesterol word very loosely, and they said, "Hame to cholesterol hai." Now, whether it is high or whether it is low, whether it is
No,
absolutely
it's like
fine.
cholesterol hai. It's not a disease.
Yeah,
It's
what
basically
is it?
cholesterol.
Because it is present in your body makes it. So give me the entire lowdown on
So
cholesterol.
the lowdown is that 85% of the cholesterol that you measure in your blood is made in your body. I
Okay.
mean, if Bhagwan ne dita hai, so why are we looking down upon it? 85%, only 10-15% is made by the body.
Mhm.
That's why. Other
Mhm.
things is that cholesterol has about 10 jobs to do.
Okay.
It first makes the lining of the arteries so that will crash now then. Then
Mm.
there's another thing called myelin which lines the nerves, one now then.
Mhm.
Then it's when you got the winter, the cholesterol goes up. When you're summer, it goes down. That means it's so intimately involved in your thing. Then it's the
Okay.
biggest agent which takes away all your inflammation, fights all your infections, everything,
Mhm.
all that stuff. Then
Yeah.
vitamin D cannot be made if there's no more cholesterol.
Uh,
Now comes this good and bad cholesterol. Now, this is one funny thing. Can they see if good cholesterol to bad cholesterol? Hello? Good morning. Is this good cholesterol and this is bad cholesterol? How can they ever think one good and bad on one side of our body? How foolish it is. And secondly, LDL and HDL are called bad and good.
mhm.
First of all, LDL and HDL are not cholesterol. Did you know that?
Okay. No, I actually, in fact.
Yeah, so
Yeah.
LDL and HDL are taxis, carriers, which are carrying a passenger called cholesterol. And when it's good or bad, it has no meaning because LDL is the guy who takes the cholesterol to all its 10 sites of action.
Okay.
So how can it be bad? When it becomes bad is that when your body gets inflamed. Now,
Mhm.
inflammation in our body causes inflammation in the LDL.
Okay.
But cholesterol is the passenger. Cholesterol ki galti thodi na hai. Only the taxi driver is zero, not the
True.
cholesterol.
Yeah.
So what happens is that when the taxi goes into your arteries, it makes a plaque. You understand plaque?
Yes.
That's how. So when you get a plaque, the cholesterol puts a band-aid over it.
Okay.
But you continue eating all the nonsense thing, that means inflammatory foods, your allergies, your sensitivities, your intolerances, the gut health,
Mm-hmm.
your nutrition,
Mm-hmm.
exposure to heavy metals, exposure to radiation, all these 10 things are causing inflammation in our body, in our lining. So it is the inflammation which is causing the problem. So cholesterol is actually putting a band-aid on that inflammation.
Okay.
Then you again eat nonsense, cholesterol puts the thing, and it carries on and on till the artery gets blocked. You have a heart attack, you die, we do a post-mortem and we find cholesterol, and they say, this is the guy who has caused
This
it.
is
It's like blaming the fireman for the fire.
true. True. Dr. Saab, what sort of a role does alcohol play in raising your cholesterol levels and then subsequently leading to heart
You
disease?
see, it's not the alcohol, it's the sweetness of the alcohol. For example, gin and vodka has much less, then is whiskey, then is rum, and the worst is beer.
Okay.
So now alcohol, you see, is great for fun. It's great to sit and sit with buddies. And of course, it's great fun, so you must do it. But if you ask me, does it do anything in the body? Go on now.
What I meant was, isn't it considered as like a sort of a slow poison that your liver is trying to detox?
No, slow poison is a little harsh for this. You see,
Okay.
the problem with alcohol is the sweetness of the alcohol.
Okay.
It's the sweetness which causes the problem. And then
Okay.
excess alcohol has got other issues because alcohol, being a ready burner, uses its ready burningness for using of this thing, so the fat doesn't burn. You understand?
Okay.
So the
Okay.
alcohol is doing your metabolic health,
Mhm.
but that's not the right way of having metabolic health. So what happens is that the fat which is to be used doesn't get used. That's why you got fat. It's not the alcohol which is making you fat.
Okay. Dr. Saab, what is your opinion on insulin spikes again, which is the new term like cholesterol? Everybody is talking about insulin spikes now, whether you're a diabetic or you're not a diabetic. Whatever you're eating, if it leads to an insulin spike, don't eat it. Is that true? How?
Yeah,
What I mean is, how
it's
true
true.
is it? And
I'll
does
tell
it
you.
rapid aging? Any sort of insulin spike in your body? When do you need it? When do you not need it?
You see, first of all, what is insulin? What is glucose? Insulin job is to put the sugar into the cell for activity, for utilization. That is 20%. Another 20% is put into your liver for storage. And the third 20% is put into your muscles for usage. That means only 40% of the insulin is being used. What happens to the rest of the 60? Take a guess. It is stored as fat.
Okay. Okay.
See the difference. So it's stored as fat for a rainy day. And you can't change it because it's in our DNA. Us time when the food was scarce, the only way these guys could survive for years, days on end, is the fact that insulin was storing fat and reduce fat burning.
Okay.
Now, nobody knows the fact that insulin's job is to store fat and reduce fat burning. Now, that's
Okay.
in our DNA. We don't need it today, but it's in our DNA. Secondly, nobody also knows that actually this storing fat is also the job of insulin. That
Okay.
means now we have been told by the big people, I don't want to name those people, that you must wake up in the morning and eat something, then have the breakfast, then have a snack, then have lunch. Most people are eating 6-7 times a day.
Hanji.
That means 6-7 times a day we are getting an insulin spike,
Okay.
and this issue, and the insulin is banging it down, and
Mhm.
up and down, up and down. This carry is going on, but each time insulin banks the sugar down, it is storing fat. That means if I'm eating 6-7 times a day, in one day I'm storing 7 times of fat. So how to handle it? That is how the word intermittent fasting came. First of all, I hate that word because it's become a fad word. Nobody
Okay.
cares what is intermittent fasting as long as they're doing intermittent. Somebody is doing intermittent. When do you do intermittent? I start my first meal at 5 o'clock in the evening and the second meal at 3 a.m.
Mhm.
So, you have to follow the body clock as well.
Yeah.
You can't just call it intermittent fasting. So I removed that word. I hate that word. It's become a fad word. Just
Okay.
call it time restricted eating. So the insulin, as I told you, is very important for everything. It also stores fat for a rainy day. It works all your metabolic organs. So it's a very crucial thing. So, but we don't want high insulin in our body. That's the thing.
Doesn't it, is it the kind of foods that you eat? Now, if you have high fiber and if you have protein, isn't that responsible for stabilized insulin levels first?
Of course it does. Of course it does. You see, but you can't change the function of insulin.
Okay.
Insulin's job is to bring the sugar down and put the sugar in its right place into your body, into your liver for a useful purpose. But when you overdo the glucose, the insulin also have to be overdone. When it's
True.
overdone, then it becomes like a little rope. That's the problem. It's not the insulin which is caused.
So we don't need to really put us like a glucose monitor on
Yes,
our
why not?
arm.
Why not? No, why not? You see, I put the glucose meter to see when I'm giving a patient the treatment. So I need to tell them that now some people have insulin, some people don't have insulin.
Mhm.
But regardless of what it is, we need to know that how is the sugar responding to what type of food. Now,
Okay.
everybody's gut is different. Now, we know that the gut bugs rule our life, which means that if you eat some butter
Mhm.
and your sugar rises,
Yeah.
if I eat butter, it doesn't rise. So
Mhm.
now we are also at the mercy of our gut bugs because the gut is controlling your brain and your mind. Remember that. You see, all the neurotransmitters are made in your gut. From the gut, it goes to the veins, into the arteries, into your nerves, into your spinal cord, then into your brain, and then it comes down. But remember, it's the gut guys who are doing it. So पहले gut देखता जी, उसके बाद बाकी कुछ.
Now, I read somewhere very recently that the heart attack that you get at 50 begins at 20.
It's an overdone story in the sense that you say कि भी 20 से heart attack शुरू हो गया. It's not heart attack. Heart attack is caused by wrong eating, wrong thinking, wrong
Yeah. So,
everything
what
wrong.
I was coming to was that why are so many younger people these days getting blockages in their heart and getting heart attacks? Why are they so prone to heart attacks these days?
Yeah, because you see now people, there's a large number of people who are now really doing well. They're
Hanji.
listening to all what we are saying and how to do. So they are doing very well. But
Mhm.
they want to get on with life. You see, these people and all the, people who are wannabes who want to do this and want to do that, they want to eat, they want to do more work. They're not concerned about their, nutrition.
Mm.
My view is that you need two things in life, nutrition and mind.
Okay.
If you have the right mind, then you would do the right things. And when you have good nutrition, that's fine. So nutrition is left back. Everybody wants to make a quick buck. I mean, of course, a lot of young people are doing a lot of good work and gym and things like that. But some people are so involved in work that they're not concerned about that. So this is one of the reasons that people are getting heart attacks. The other reasons are that a lot of them people are eating stuff which is storing fat.
Okay.
So when the fat is being stored, it's one of the risk factors for heart disease.
True.
And so you must understand that at this age, this is happening. So
Mhm.
what I have said is that at least start doing a CT coronary angiogram.
Mhm.
So that the CT coronary angiogram tells you that it doesn't tell you that the block is obstructing blood flow. That it can't tell. What it does tell is that there is a block. Yes. How big is the block? Yes. How many places is the block? Also it tells you about your calcium calcification.
Okay.
This is what it can do. So it gives you a good idea of what you have in your listing. But it does not tell you that is the block obstructing blood flow or not. For that, we need to do another provocative test, which we call the thallium test. And the thallium test tells us that is the obstruction causing block.
Okay.
So sometimes we need to do both. But if you do the CT angio and you find that's a zero, then the matter ends. Then you know to worry. And I also would like to tell you, if you're interested,
Hanji.
what is angina and how is angina felt? Because most people don't understand. Is there any other question? Because this is an important one.
No, please go ahead. Please go ahead. Yeah.
Okay. So you see, angina is felt in the act of exertion, and it is felt here,
Okay.
not in the heart area.
Okay.
angina is felt in the solar plexus region, and
All right.
it's like this. People will say this. If
Okay.
people say this or this, I know it's not a heart problem.
Okay.
They say crunching pain in the act of exertion.
Okay.
In the act of exertion. That means I'm running up a flight of stairs, I'm going up a flight, like that. Then the same pain can also go from here and give you a throttling sensation. And people think it was gala kharaab ho gaya ya kuch galat kha liya. So people must understand that.
Yeah.
Also, it also gives you, जैसे जबड़े में पकड़ लिया किसी ने, somebody is catching your jaw. And then the angina can come down symmetrically in both arms, not just the left arm. So here, 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 here. So it could be fragmented. That means there are some people who will get only a jaw pain, and they think it's a dental issue. And it could, dentist के पास होगा दांत निकाल देता है. और फिर this comes into your shoulders. You go to an orthopedic surgeon, they will give you an injection, not realizing that this is it. So therefore, you must understand that it is an exertional point, but when supposing you're getting into a heart attack, then the same symptoms, if they don't go away and you're sweating and you're going down, think that you may be getting a heart attack. So immediately, don't dilly-dally, doctor ko ghar mein bula lo aur dekhenge. Immediately go and check yourself.
So, to a healthy person, is there a way to tell if your heart is weak or strong?
That's what I said. You first do a CT angio, it tells you there's a block. If there's no block, the matter ends. If there is a block, then we do a provocative test, like a treadmill test or a thallium test, and that will tell us the answer.
Okay. And if, let's say, I don't have any of these symptoms of what you just mentioned, if I'm just a normal person, I go to the gym and I work out regularly, I eat well, do I still know whether I have a healthy heart or a weak heart?
If you got all this done and they are all clever, there's one problem is the vaccine problem. See, majority of the heart disease, majority of autoimmune illnesses are all caused by vaccines, not the COVID. The COVID is a kaddu item, I can tell you that. It's the vaccine which is killing us. And if you open up what the vaccine contains, you have a heart attack in any case with it. And that's the plan, to keep people sick.
Which vaccine? To be more specific, which vaccine are you talking about?
Vaccine, I won't mention.
Any vaccines? Okay.
All these recent vaccines.
Okay.
Why do you think they've come up? A vaccine is made in 2 months, 3 months. Vaccine takes 10 to 15 years to really. Here they are putting. I don't want to talk about.
I've understood. Okay, so to sum up whatever you said about your gut being the new brain, so what is good for your heart is then eventually good for your brain as well. When I talk of nutrition, when I talk of movement, whatever is good for your heart is good for your brain because the two are interconnected.
Yes. You see, the gut controls everything. So that is why I say that is your first. If they call it the second brain, it's the first brain. It's taken it over. So now it's important of what you eat. So as I said, what you eat is also controlled by your gut bugs. And it's very important to make a perfect answer in your nutrition, which is why what I mentioned, that the way you eat is very critical and making the gut bugs happy. What makes the gut bugs happy? Fiber, fermented foods, and insoluble starch.
Okay.
You give them these three things, they'll jump out and give you a kiss or a hug. And so we have to live with the gut bugs.
Give me these prerequisites that everybody should keep in mind. If someone is having a heart attack at home, heart attack occur at any given time of the day or night, and if someone is having a heart attack at home, how does one cope with it? How does one steps that you take before you go to the hospital? How does one go around it?
First of all, you have to understand the symptom, like I explained. Like a heart attack will give you that same pain here, or it can go up till here. So please be aware that suddenly a pain comes up in your shoulders. It's not something that is a shoulder joint. Shoulder problem will be with you for 6-7 weeks or something like that. So be aware that if you get a jaw pain, if you get a throttling pain, or sudden pain down the arms, or pain in this side, it's an angina. If this angina persists even after taking your sorbitrate or something or resting, and you start getting down and you're feeling dizzy and you're feeling, as if you're going to pass out or you're sweating, then it's a heart attack. Now,
Okay.
as I said earlier, do not call a doctor at home because by the time the doctor comes, you might not reach there. Today you have so much of traffic. So if you feel that there's this thing, just get into the car and go. But you have to have something when you're sick. That means you have to carry some sorbitaries, you have to carry a statin, and you have to carry some other things which you can immediately use to do that till the time you reach there. So that means at least you protected yourself during that. Another
Okay.
thing that I've seen that works is that you take a different type of cough. Like take a deep breath in many times, and it triggers the heart back into action often.
Okay.
So things like this do help. But what I'm trying to say is that do not waste time calling people or thinking. I mean, even if the fact that you made a mistake going there, it's well worth that mistake. Because if you make the wrong mistake, then you know what can happen.
Now, in the event that somebody has a heart attack and is taken to the hospital where they do these plethora of tests and the candidate is eligible for a bypass heart surgery or an open heart surgery, what are the things that they should know before they go in for a bypass heart surgery? Are there any complications post a bypass heart surgery that a patient can get or they should be aware of before they get one done?
This is a very generic question. You see, it all depends upon who you are, what your age is, and what is the nature of this thing. Are the arteries important arteries or the not important arteries? Is the blockage in the mouth of the start of the artery or at the end? All that depends on your decision of making stents or bypass.
Okay.
Bypass is now sort of getting out of the, very few people, people who have multiple blockages, all the vessels, not in one point, but in multiple points. These are the people who normally need. But today the stenting has become so good that even now they're putting wires through the block and catching the block, bringing it out. All that is done.
Okay.
Now, people often say that, oh, people are putting stents for no reason. Now, that's partly not true as well. In the beginning, when stenting happened, everybody was very keen to do stent power. But what we realized that the stent you can do without it later. Later, we understood that you can do without it. It's not that just you have a blockade, you put it.
Yeah.
You need to have a blockade which is obstructing blood flow. So now there is a method which is called the FFAR, which means they put a wire through the block and they test something out to see that is the block obstructing blood flow. Now, even if you have a blockade of say 70% and the block is not obstructing blood flow, then you have no business to put a stent.
Okay.
So these things should be known. I mean, today people say कि लोग ऐमी कर रहे हैं. Not really true. Today,
Now, I'll tell you the reason why I have asked this question because my father was in this state. He was a candidate for a bypass heart surgery. Post the bypass heart surgery, when he was in the ICU, when he was recuperating, he got a clot in his brain after this. Now, we were not told that this could happen. And eventually, I saw a few other patients also going through the same thing. They were also coming out of a bypass heart surgery and then, subsequently getting strokes. But because of his age and other things, the stroke sort of hit him quite hard. Like he was paralyzed on one side. Dr. How common are these strokes post a bypass heart surgery? Are they very common?
No, not necessarily. You see, the stroke is not coming from the heart.
Okay.
The stroke is coming from the arteries which are also blocked.
Okay.
You see, so the people who have blockages in the arteries, in the heart,
Hanji.
also will have blockages elsewhere, which will be in the heart, it will be in the arms, it can be in the legs, everywhere.
Okay.
So, so it all depends upon how the blockages are distributed in the body. Some people have only one, some people, your dad must be having, blockages in various other arteries as well. So when your point is that when you are looking at the heart, you must always look at all the other arteries which could be blocked. The carotid artery, this artery, the arteries in the brain should be looked before we do any major surgery.
Okay.
And that may be the sort of overlook or whatever somebody may have done.
If you were to give a list of 5 questions that you should ask your cardiologist, to anybody. 5 questions. What are the top 5 questions that come to your mind that you should be asking your cardiologist?
Well, first and foremost is that I want to first find out, is my heart in trouble or not? And then
Is your heart?
in trouble or not? How they
Okay.
will tell you that you do this, you do that, you do a treadmill test. And if the treadmill test is a very useless test on its own.
So that's one.
Yeah, we've stopped doing treadmill tests completely. That's why
Okay.
we do either a thallium test or thallium test, is in a big hospital, it takes few hours. But there's another test called Debunking stress echo.
Okay.
So normally people used to run on a treadmill and do the test, but I've given that up because by the time you get it, you probably have lost that period, which could be just a minute or two.
True.
So what now do is that, and that was in not having a thallium test, you have a equally good test, but not 100% as accurate as the thallium test, that I put my patients into the ICU. They lie down and we don't do any treadmilling. We give a medicine which will rev up the heart as if you're running.
Okay.
And the advantage is that you have the transducer in the heart watching the heart all the time. Now, as I'm raising the amount of push that we are doing, the heart, if it's doing a nice job of pumping, suddenly slackens. I know there is a blockage and I'll stop it immediately. And
Okay.
as we grow older, there are specific tests.
Mhm.
And I mean, it's difficult to list all of them like that. I mean, I can maybe write it down and send it to
Yeah.
you somewhere. But you have to do a complete testing. A lot of the people are missing out on many things.
Yeah.
For example, people are doing only fasting glucose. And
Yeah.
give an typical example. Fasting glucose, full stop. After eating glucose, full stop. Pani khatam. Now, you have never mentioned how much insulin is there in your body. And then what I do is for every diabetic patient, fasting sugar, fasting insulin. Then I make them sit down and have a big glycemic meal. I have never seen doctors doing that. Have a big glycemic meal, and 2 hours after that meal, we check the sugar and the insulin again. We want to know कि खाली पेट तो तुम्हारा शुगर हो सकता है ठीक, खाली पेट अब इंसुलिन भी ठीक है. But I have seen insulin levels at hundreds because nobody measured your postprandial insulin.
Ji.
So please understand that every the person should tell his doctor that please give me a time where I am eating a large meal and after 2 hours I have to measure the insulin and the sugar levels.
Okay.
उसके और बहुत details हैं, but this must be done.
No, but why are we so scared of getting blood tests? Like, I'll give you an example of my mom. When I tell her to get these regular blood tests done and the regular, blood panel and all of that, she's like, what?
मैं नहीं कराता.
The response that I get from her is that अब ये एक ही लाइफ है, अब मुझे अगर कुछ पता चल गया फालतू में उसका भी स्ट्रेस होगा, छोड़ो की लोड़े, रहने दो, खाओ पियो, खुश रहो. So can you please debunk that myth for her?
See, the key is that khao piyo khush raho is a very important thing. Because when you're khao piyo khush raho, then you do not get illnesses. Because you have good fun, you're laughing, you've got good friends, you're doing things for people. So that is why I say that you must do something which is either a contribution to the society or to the self or personal development, which could be maybe doing the Argentinian tango or learning another language and giving some that is part of it. So therefore, these people like that have got larger hearts, literally.
Okay.
These are the things which are important. But you can't, negate what you need to do. You can't say कि जी जो होएगा सो देखेंगे.
Yeah.
No, जरूर करो, ऐश करो, दौड़ लगाओ. But पता तो कर लो कि तुसी कितने गए हो.
It is imperative that everybody should be getting their regular blood work done. And this is once a year that you're saying?
You see, once a year is one thing. Then people who have comorbidities may have to do it twice. And then some people may have to do certain tests every 3 monthly, depending on, let's say, for example, thyroid. Now, thyroid is a very, unused thing. Everybody does some thyroid, khatam. Nobody does pre-thyroid. Everybody does total. That's wrong. And that nobody is measuring in a routine test. Then you routine sara kuch kar lo. They are not measuring the antibodies of the thyroid gland. They are the things which are causing autoimmune illnesses.
Okay.
So people are missing out on certain tests.
You are so into healthy eating, healthy living, doing everything. I'm sure, I am in it as well. When I visit hospitals and I see that a large part of their food courts and a large part of their,
It's actually bull crap. Is food.
the food that they let me complete what I'm saying. The food very recently I visited a hospital and the food courts over there have only junk food there. They have all sorts of fast food joints which are primarily responsible for putting you there in the first place.
Agreed.
Why is it happening? Where are we heading?
Because it's easy na to give the junk food.
Okay.
वो मतलब इतने लोग आ रहे हैं तो उन्होंने junk food ही खिलाओ.
Mhm.
So that's not fair actually,
Okay.
because then people are getting used to eating that food.
Yeah.
But food is such a wonderful item. I mean, everybody is running after food, but nobody's running after good food.
Mm.
So that is why, I have good nutritionists backing me up. But बातों करने में मैं भी nutritionist हो गया. मैं भी meal plan बता देता हूँ. So I tell them what to eat. You have to. You can't do that. Take a place like London, you will see that it is at least 20 times worse what they're serving the food in the hospitals to the patients. Leave
Okay.
alone their visitors.
Okay.
So that's why these people are more sick than us. They should pack up and go.
Okay. Pack up and go.
Yeah, but I've seen many countries in the world. Look, take the UK for example. It's the worst place to get sick.
Mhm.
I tell my patients that if you get a heart attack, come back home. I'll look after you.
That's largely why people who are settled abroad keep coming to India for treatment. Everybody is.
I can count up to 120 to 150 patients who come from London,
Mhm.
and they take 6 months to do this. I do this in one day.
Okay.
In my hospital, you come in, आपको examine किया, आपका blood ले दिया, आपका ultrasound हो गया, आप cardiac checks हो गए.
जी.
But it was a day you learn everything. Third day, send them back. India is the best place for medicine, I can tell you that.
Okay.
There is now a very few places in the world which have certain things which we don't have. But if you ask me which is the best place to be in, it's
However, diabetes wise, I agree with you on this point, but we are also the diabetic capital of.
Oh yeah. I just did a reel on that recently. We actually have very big house. हमको खाने का बड़ा चक्कर रहता है. तो खाना में we forget that we are eating the wrong food. We are eating the wrong oils.
Yes.
That is very important. For example, refined oils should be packed up and sold. So my oil picture is either you take ghee and white butter from A2 grass-fed milk. You can take mustard oil and sesame oil, which is made from the kolu,
Yeah.
which is cold pressed without any additives.
Yeah.
Then, of course, you have almond oil and coconut oil and things like that.
And there's avocado oil as well that has a high.
Then you get to olive oil, which you shouldn't cook with, regardless of anything, whatever says. Then you have avocado oil, you have nut oil, you have walnut oil, and you have hemp oil. These are all good cooking oils, but our real DNA resonates with ghee and mustard. That's how we were born. We were never born with avocado oil, you see.
Shukriya ji, Dr. Chopra, so lovely chatting with you about everything and basically preventive health, more importantly, how to just keep yourself.
Yeah.
There you have it, a cardiologist and a functional medicine doctor telling you what's good and what's not. Take tips from this conversation and incorporate them into your daily life. Make healthier choices. It's actually very simple. Join me on Instagram and on YouTube on my channel, The Lifesavers Show, and tell me what you think of our content.